Growth hormone, GH, and insulin-like growth factor 1, IGF-1, are hormones involved with growth in the body. The growth hormone insulin-like growth factor 1 axis, also known as the GH-IGF-1 axis, is a system of chemical signals in the body that plays a major role in growth after birth. It originates within the head, below the brain, in the pituitary gland, where GH is made. From there, GH is released into the bloodstream. GH travels through the bloodstream to eventually interact with target molecules called GH receptors, GHR. GHRs are primarily located in the liver, but they also can be found in various other tissues throughout the body. This interaction stimulates the generation of IGF-1, which then enters the bloodstream and has a growth effect on target tissues. This results in linear growth, meaning an increase in height or length. This is why patients who have abnormalities of the GH-IGF-1 axis experience an abnormal growth pattern after birth, resulting in mild to severe short stature. A diagnosis of severe primary IGF-1 deficiency, SPI-GFD, may be made when a child is much shorter than other children of the same age range and gender, determined by a height standard deviation score, SDS, less than or equal to -3, has IGF-1 levels in the body that are much lower than normal, determined by a basal IGF-1 SDS less than or equal to -3, and has levels of GH in the body that are normal or even higher than normal. SPI-GFD is caused by a genetic mutation, meaning that an alteration has occurred in the DNA sequence of one of the genes involved in growth. Mutations in GHR genes are the most common in SPI-GFD, but mutations have also been reported in IGF-1, STAT5B, or ALS genes. STAT5B and ALS genes are important for growth because STAT5B produces a protein that activates other genes, and ALS produces a protein that binds to IGF-1. It is possible to treat this condition with mecasermin, a genetically engineered human IGF-1 therapy that is the only FDA-approved treatment for SPI-GFD. Increlex mecasermin is a prescription medicine used to treat children who are very short for their age because their bodies do not make enough insulin-like growth factor 1, IGF-1. This condition is called severe primary IGF-1 deficiency. Increlex should not be used instead of growth hormone. It is not known if Increlex is safe and effective in children under 2 years of age. Your child should not receive Increlex if your child is allergic to mecasermin or any of the ingredients in Increlex, has finished growing, has any cancerous tumors or growths, or has a history of cancer. Your child should never receive Increlex through a vein. Once IGF-1 is released from the liver and other tissues to enter the circulation, it eventually reaches various target tissues in the body, such as muscles, bones, and various organs. Cartilage is a flexible connective tissue that serves various functions in the body, such as reducing friction between joints and holding bones together. However, in a growing child, some cartilage is replaced by bone in a process called ossification. In the tissues, IGF-1 stimulates bone formation processes such as cartilage cell proliferation, which is a rapid increase in the number of cartilage cells, and ossification to form new bone tissue in long bones and vertebrae. Overall, this results in cartilaginous bone and muscle growth. This leads to statural growth.
Indication: Increlex mecasermin is a prescription medicine used in children 2 years and older with short stature that have severely low levels of the hormone, insulin-like growth factor 1, IGF-1. IGF-1 is needed for normal growth. Increlex is not a substitute for growth hormone. It cannot be used for children with short stature due to low levels of growth hormone, malnutrition, when their thyroid gland doesn't make enough thyroid hormone, or when taking anti-inflammatory steroids used to manage inflammation. Important safety information. Always give Increlex exactly as your doctor directed. Do not take Increlex if you are allergic to IGF-1 or any of its other ingredients. Report any allergic reactions. Increlex should be injected under the skin. Subcutaneous injection. It should not be injected directly into a blood vessel. Increlex should not be used after growth plates close, which happens during puberty. Increlex should not be used in children with cancerous tumors or a history of cancer. Hypoglycemia. Low blood sugar. Increlex should be administered 20 minutes before or after a meal or snack and should not be administered when the meal or snack is skipped. Checking blood glucose levels is recommended. The dose of Increlex may need to be adjusted until an appropriate dose is decided by your doctor. Intracranial hypertension. Increased pressure in your skull may occur because of cerebrospinal fluid buildup around your brain. Therefore, your doctor may require an eye examination at the start of Increlex treatment and periodically during the time you are taking Increlex. Lymphoid tissue hypertrophy. Lymphoid tissue hypertrophy is a non-cancerous increase in the number of immune cells called lymphocytes. Patients should have periodic examinations with your doctor to rule out potential complications. Slipped capital femoral epiphysis. Slipped capital femoral epiphysis is a bone problem where the top of the upper leg, femur, slips apart. This may lead to a serious condition where bone tissue dies due to a lack of blood supply, osteonecrosis. Get medical help for your child right away if your child develops a limp or has hip or knee pain. Progression of scoliosis. Your doctor will monitor you during treatment with Increlex if you have a history of scoliosis. Malignant neoplasia. There have been reports of cancerous tumors in children who received Increlex. It is unknown whether there is any relationship between Increlex therapy and new occurrence of tumors. Tumors were mostly reported in patients with rare genetic conditions of short stature associated with a higher risk of cancer, or in patients already at risk of cancer. The tumors were seen more frequently in patients who received Increlex at higher than recommended doses or at doses that produced IGF-1 levels above normal for age and sex. Your doctor will carefully monitor you during your treatment with Increlex for development of tumors. If cancerous tumors develop, your doctor will stop your Increlex treatment. Risk of serious adverse reactions in infants due to benzyl alcohol preserved solution. Serious and fatal adverse reactions can occur in neonates and infants treated with benzyl alcohol preserved drugs. Use of Increlex in infants is not recommended. The most common adverse reactions include low blood sugar, reactions at the injection site or throughout your body, and enlarged tonsils. You are encouraged to report negative side effects of prescription drugs by contacting Eton Pharmaceuticals, Inc. at 1-855-224-0233 or the U.S. Food and Drug Administration. FDA at www.fda.gov/safety/medwatch or call 1-800-FDA-1088. Please see full prescribing information for more information.